of a policy blueprint called Building Efficiency in Cancer Care, kindly hosted by Mr. Tomislav Sokol, member of the European Parliament, to whom I would like to give the floor for his opening remarks. The floor is yours.
Thank you very much. I'm very honored to be able to host this event because I think that in the modern world, with all the changes that are going on with healthcare in Europe and worldwide, building and having more efficient cancer care and healthcare in general is crucial. We know that the demographic structure of Europe has changed, that we have a much more elderly population than ever before. The health technologies are being developed more and more. And of course, all of this is leading to increased spending of healthcare systems. And this spending will not go away. Just the opposite, I believe that the increase in spending will be even stronger in the years to come. With this situation, with the healthcare costs rising and rising, and the national and healthcare budgets not becoming any bigger, I believe that having efficient system with optimal use of resources is crucial. I think that this is one of the ways how we can make healthcare systems perform their functions. Protect the well-being of the population, but also for them to be as sustainable as possible in the future. Of course, cancer care is no exception to this issue, and this is why I believe that this topic that we're discussing today is really up to date and very, very important. Me, as member of the European Parliament, as member of the BECA Committee, Special Committee on Beating Cancer, and recently the ENVI Committee on Public Health, I'm very devoted to issues of healthcare and especially on beating cancer. Of course, we know that healthcare is primarily a national competence, so primary competence and power to organize and finance healthcare systems rests with the member states, but I believe that the European Union can do a lot to help member states better perform this function. And EU, in this sense, has many both regulatory and financial instruments at its disposal to really help national healthcare systems perform in a much better and more efficient way. And the one document which kind of summarizes all of these instruments is the Europe's Beating Cancer Plan that was adopted by the European Commission. But also, I'm very glad and proud that we in the European Parliament recently voted and approved our report on the Europe's Beating Cancer Plan, which stresses the Parliament's priorities on how to make cancer care better in Europe. So better in terms of providing better health outcomes, but also for national healthcare systems and cancer care to become more efficient than before. I'm also very glad that me, as member of the Regi Committee on Regional Development, the main task of which is to reduce differences in terms of economic development and living standards across the EU, have also been made a rapporteur on the report on how to use cohesion policy funds best in order to reduce healthcare disparities which exist in the EU. Because these disparities, these different possibilities to access healthcare, quality healthcare in the EU, different quality standards across different national healthcare systems in the EU are one of the biggest problems that the European Union is facing today. And unfortunately, I have to say that currently we have really first and second class citizens in the EU because of this problem. Of course, not all of the national healthcare systems can invest the same amounts of money in order to improve healthcare outcomes, but I believe that also more efficient use of resources can also reduce these differences that exist today. And me, as the rapporteur on this very important topic in the Regi Committee, have emphasized some things which I believe are very important in this discussion, which relate to efficiency of healthcare systems. So first, what is important is that cohesion policy funds are still the biggest source of investments from the EU budget into healthcare. They have been like that in the previous budgetary periods, but also it will be in the future budgetary period. Just to illustrate this, in the EU for Health program is current for the next 7-year period will amount to 5.3 billion euros. while healthcare spending from cohesion policy in the previous 7-year period was totaled around 25 billion euros, which means 5 times more. And I believe that this amount will even increase in the years to come, which means that cohesion policy is very important as a source of investments and providing help to member states to have better healthcare systems. But one important thing that I emphasize in my report is the fact that when this money is spent, this European money is spent, we also need to assess and evaluate the results of this spending. And to do this, we need to have health outcomes as benchmarks, which are used to evaluate how the European Union money from cohesion policy is spent in member states. I believe this is very important. And in this way, we can really see whether European money is really creating an added value in terms of better and more efficient healthcare systems. And I think that this is a very, very important topic that needs to be addressed. One other thing that I emphasize in my report, but which I was also able to put in the Becker report through my amendments, is also the better and more efficient use of resources in border regions. I believe that this is also one area where EU can do a lot to improve the situation as it is today, because in many cases, on one side, there are situations where patients can access have a hospital cross-border providing cancer care, but for administrative and bureaucratic reasons, they cannot access these hospital wards, experts, and equipment, but have to travel 50 or 100 kilometers to a hospital in their own country, in their own member state, because it's easier because of health insurance and bureaucracy and all that. It's easier for them administratively to go to a domestic hospital, even though it will be much easier for them in reality to access hospital in another member state across border. I believe EU can do a lot to change the situation. I believe EU can use its regulatory framework, but also its financial systems, financial programs like Interreg program, to facilitate and create incentives for national health insurance funds to enter into contracts with hospitals across border, and in that way make it possible for patients to access cancer care in a much faster and more efficient way than before. But to look even more broadly at this topic, I believe that what you can do in the future is to create a network of regional hospitals, centers of excellence for different, for instance, types of cancer, which would then be able to provide hospital care, cancer care to patients not only from their member states, but also from bordering regions of other member states. And in this way, a much better use of resources can be achieved by optimal use of resources, because we know that in many cases you have hospitals in different member states who also have the same boards, the same equipment, the same types of experts across borders, and they are not utilized in the best possible way. But on the other hand, for some other types of cancer, we have lack of expertise, equipment, etc., in different member states. So I believe that organizing this network of centers of excellence, which will be specialized for treating certain types of cancer and covering several member states, would lead to much better and to much more efficient use of equipment, use of funding, use of resources that healthcare systems have at their disposal. So I believe that these are some things where EU can really achieve to building more efficient national healthcare systems, to help the member states have more efficient healthcare provision, have better health outcomes, and etc. But I'm very happy to hear also the experts what they have to say on this topic, and I will be glad to try to include some of the ideas and some of the proposals and suggestions from the report and from today's discussion into future policy actions on EU level, wherever that is, of course, politically and legally possible. So thank you very much, and I wish you a nice and fruitful event. Thank you.
Thank you very much indeed, Mr. Sokol, for your contribution, your participation. I'd like to turn now to Alex Filichevas, the president of All.Can, who will illustrate the findings of the blueprint on building efficiency in cancer care. Alex.
Thank you so much, Eduardo, and thank you once again, MEP Tomislav Sokol, for the introductions and for hosting the event here today. And we are launching today the new flagship publication of All.Can Building Efficiency in Cancer Care. And it's reflecting All.Can's mission. This blueprint offers a broadly applicable framework to support collaborative policy action to improve cancer care efficiency for better patient outcomes, but also sustainable healthcare systems as well. And building efficiency in cancer care is a complex challenge. It requires close collaboration among all stakeholders at all levels. And I am so grateful and thank you all once again for joining us today for this discussion, as well as to our expert panel who will be following shortly. So it is important to briefly mention what All.Can is. I know that some of you might be familiar with All.Can, some might be new to it. So if we could just go back one slide, that All.Can was originally established in 2016 as a coalition of multidisciplinary, like-minded profit and non-profit organizations, as well as individuals. And All.Can then set out on a mission to find solutions to the challenge of waste in cancer care. And it was born with patient and family representatives, healthcare professionals, economists, politicians, really, really broad group of people who were and remain united in that belief that we can do better with these resources that are currently available in cancer care for the benefit of cancer patients today and tomorrow. And there is also great strength in our international community here. In All.Can, we have a growing number of All.Can national initiatives with almost 20 established national chapters right now. And many of these have grown as well and established organically, pointing to that real global need for improving efficiency and delivering better cancer care for patients within the countries. And All.Can recognized early on as well that the challenges to the sustainable cancer care cannot be resolved by any stakeholder group alone. And we continue to also work together in various partnerships at EU and international level as well. And before we dive into the report, it's also, first of all, important to define what we mean by efficiency. And for All.Can, efficient cancer care delivers the best possible health outcomes using all resources available, with a particular focus on what really matters to people with cancer and to the society as well. And it's important to note that efficiency is not a means to cut costs. So the resources freed through increased efficiency should be reinvested to advance innovation or increase systems resilience. And efficient cancer care has never been more important, both to optimize patient outcomes, but to also ensure the long-term sustainability and resilience of our healthcare systems. For cancer patients, these inefficiencies in healthcare can lead to premature mortality, reduction in quality of life, financial and time losses, and inequities between different groups in society too. COVID-19 pandemic has had another devastating impact on people with cancer and on cancer care across the world. And it has also deepened inequities and significantly curtailed the progress towards achieving the UN Sustainable Development Goals. And as this burden of cancer continues to grow, so does that need for urgent and sustained policy leadership and collaborative efforts to build efficiency in cancer care. So that's why we are here today to launch this blueprint towards the policy actions needed. And the blueprint itself, we've developed in response to this need. And specifically, the objectives of the blueprint are to highlight those key areas of inefficiency from All.Can's unique multi-stakeholder and global point of view, offer recommendations for local and national adaptation, and also showcase good practices, taking away the learnings from each other and applying those across the world. And we are extremely grateful for the valuable input we have received from All.Can international members, national initiatives, and the external experts as well we consulted in the drafting of this publication. So building efficiency in cancer care starts with two essential overarching values: being people-centered. So this means aligning all aspects of cancer care and prevention to meet the needs of patients, carers, and the general public too, in collaboration with the people affected. And secondly, taking a whole system perspective. So this means treating each patient's care pathway and the entire cancer care system as an integrated whole. And we do recommend that decision makers apply these principles in comprehensive and coordinated actions to build efficiency in our healthcare systems. So fundamentally, we believe that efficiency is best realized by ensuring people in cancer have access to a holistic, people-centered, and equitable cancer care continuum. And there are significant opportunities to improve efficiency along each step of the cancer care continuum, from prevention to early diagnosis, treatment, and supportive and palliative care. And our blueprint takes each of these into account. And the examples can include vaccination programs to prevent cancers caused by viruses, evidence-based screening programs, employing telemedicine and remote patient monitoring measures equitably as well, and of course, where they are appropriate, and things like nutritional care support as well. So we recommend that concerted actions to build efficiency across 4 interrelated and mutually supportive dimensions that underpin the cancer care continuum I just outlined. And I will go a little bit into more detail now into these 4 pillars, so to say. So first, it is imperative that we empower and partner with people. And by this, we mean promoting shared decision-making within patient care. For example, through measures to improve communication between healthcare professionals and patients and carers, employing patient-reported outcome measures or PROMs in routine care, harnessing digital health tools, and supporting and promoting patients and carers' access to patient organizations and support groups. It's also important to involve patients' representatives in wider aspects of decision-making, including in policy and initiatives to improve the efficiency and quality of care, and the efforts to improve cancer literacy within the general public and among patients and carers. These are also fundamentally important to improving efficiency. Now, healthcare professionals and providers are also key actors in building efficiency who should be supported by investing and planning urgently to meet workforce capacity and skill mix needs, enabling and also incentivizing multidisciplinary care and interdisciplinary coordination, as well as innovative service models in care, supporting education and training on improving efficiency, as well as protecting workforce well-being and safety. The third point I would like to mention is the implementation of data-driven learning systems. So data is central to quality, innovation, and overall efficiency in cancer care. And patient-relevant data, including patient-reported outcome measures, should be systematically collected, shared, and reported between healthcare providers and patients and carers. And decision makers should also take urgent action to overcome the challenges in fully harnessing the potential of data in accordance with the All.Can recommendations published last year in the Harnessing Data for Better Cancer Care paper that I invite you to explore if you haven't done so yet. And of course, lastly, we also recommend that decision makers invest in inefficient technologies. So strategically and systematically directing resources towards efficient technologies and practices, implementing regulatory and policy frameworks that incentivize and foster efficient technologies, explore outcomes-based reimbursement schemes as well as breaking down finance silos. And lastly, as well, implementing specific measures to support the adoption of innovation in practice, and also enabling equitable access for people with cancer to efficient technologies and practices in their care. So in conclusion, I know it's a quick run through the report, and I invite you to explore it in greater detail after the event. But building efficiency in cancer care should be a top priority, and being so via system-wide changes that are required. And this should, of course, be a joint effort in consultation and collaboration with all stakeholders, starting with people with cancer and their carers. And all actions should be geared towards identifying, adapting, sharing, scaling up efficient innovations in technology, and sharing that knowledge and applying it in care practices, while also disinvesting from inefficient and wasteful practices. And in order to bring about lasting change, organizational frameworks, data systems, policies, and incentives should be aligned towards efficient care, with appropriate resources dedicated to building efficiency in view of that burden and impact of cancer on people affected by it and the society. And All.Can, of course, stands ready to further support policy initiatives to improve cancer care efficiency by generating new evidence and facilitating that exchange of knowledge and best practices, enhancing cross-country collaboration and building new partnerships around the world. And so this is what our expert panel will be diving into in greater detail now. So I would like to thank you all for joining us here today, and I would like to pass the floor now to Viv, who will be facilitating the discussion with our expert panel and who has been a member of All.Can since the very beginning. So Viv, over to you.
Thank you very much, Alex, and thank you for that introduction. So now we're going to, delighted to be able to introduce our panel, where we'll be really interrogating this report and what it means from many different perspectives, both geographically and from the different stakeholders and constituencies that we represent. So I'd like you to welcome on this panel. We've got Margareta Haag from All.Can Sweden and chair of the Swedish Network Against Cancer, Matti Apro, Vice President of All.Can International, Board Member, Clinique des Genoliers, and immediate past President of the European Cancer Organization. Also Amadou Diarra, Board Member of All.Can International, Senior Vice President, Global Policy and Government Affairs at Bristol Myers Squibb. I know, Amadou, you have to leave us at 3 CET. So thank you very much for joining us, and we look forward to your comments. But when it's time for you to leave, please we'll keep the flow going and just sign off as you need to. But thank you very much. Matthias Schupper, team leader, DG Santé Cancer Team from European Commission. Sonali Johnson, head of knowledge, advocacy and policy at the Union for International Cancer Control. Maria Eugenia de la Fuente from All.Can Argentina. So fantastic lineup. And so we've got a little under an hour, so let's get straight into it and not waste any time here. By the way, for those of you who are the audience and who are watching this event, please do use the Q&A facility on the Zoom interface. We'll try and take those questions as time allows after we've heard from each of our panelists. Let me turn to you first, Margareta. You represent the patient organization, Swedish Network Against Cancer, and All.Can Sweden. Let's start at the very top of the report, which puts forward these two overarching values, being people-centered and taking a whole system perspective. Why are these two principles, why is it important to underpin all of this with these two principles in particular when we're talking about efficiency in cancer care, and what do they mean for patients, this idea of being people-centered and taking a whole system perspective?
Thank you, Vivek. I think that for patients and for the healthcare system, it's vital that the patients are in focus, and that meeting the needs of patients is really what matters to patients. That is the whole issue with cancer care or any kind of care. And these two keystones, being people-centered and taking a whole system perspective, is a must if we need to move forward and need to get an optimal cancer care in Sweden, Europe, or globally, I think. We in Sweden, we try to empower people with cancer, and we think it's a key to driving change towards greater efficiency. We should be the partners in our own care and in the whole system as well. And the system needs to empower and partner with people to promote shared decision-making once and promote person-centered care and to improve health literacy. And only with that, reducing that gap between healthcare professionals and patients will lead to optimal care and greater efficiency in cancer care. We think that if the system and the healthcare system use patient-reported outcome measures, for example, that will empower patients. If patients can be using digital health tools, technological solutions, health data platforms, that will also improve the system and it will empower patients. Building efficiency involves empowering patients, carers, and the public. And this would increase health literacy within the general public, which is very, very important if you want to strive for primary prevention and secondary prevention and optimal cancer care. And improved communication between healthcare professionals, patients, and carers is really needed to get this efficiency that we all strive for. So promoting patients, carers to access patient organizations and support groups, I think that is a must, and it's not really done a lot in Sweden. We can be better, much better. And going into the second keystone, the whole system, is a must, I think, that patients and patient representatives are involved in decision-making, in policy-making, and initiatives to improve the efficiency and quality of care, clinical guidelines development, and into the research. And I mean planning research, performing research, publishing research. We have to be there and design clinical guidelines. We need improved legislation, health data linking and sharing, and we have to be very pushy on getting that access to health data linking and sharing. And I think patients are in the forefront in doing that, really. And we also need to be involved in health technology assessment and reimbursement decision-making. So innovations and systems should be implemented and strengthened to continuously identify, assess, and adopt diagnostic, therapeutic, digital technologies, and treatment methods. We are very much involved in precision health in Sweden, which means diagnostic, treatment methods, rehabilitation, and palliative care. And we want the right patients to get the right treatment at the right time, which is precision health for us. And all this will improve health outcomes and efficiency. So efficiency should be defined, pursued, and evaluated according to what matters most to people affected by cancer, that is the patients, and not necessarily the same measurements as those measured by the health systems. And we feel that collaborating together with health professionals and politicians and researchers, that is the only way forward. If patients are not a keystone, the efficiency will lack. We won't be there.
That's very helpful and a very comprehensive answer, actually. Thank you very much, Margareta. Matti, you're here to, I guess, we'll put you in the role of representing the healthcare professional, which you are, of course. And when we go below the level of those overarching values, we're then talking about mutually supportive dimensions that underpin the efficient delivery of efficient cancer care. And one of those things that is talked about in the report is this idea of supporting healthcare professionals to think about, build, and maintain efficiency in cancer care systems in terms of organization and provision of cancer care. and particularly in a post-pandemic context. So maybe you could talk about your insights into the major efficiency challenges that you see from a healthcare professional perspective, and then maybe lead us into some specific examples of interventions that might address those kinds of challenges.
Well, thank you, Vivek. Hello, everyone. This is something that I would need more than 4 minutes to discuss, of course, but let me just put in a few thoughts about a vision from a healthcare provider as an oncologist, as a medical oncologist, on what is going on. I'd like to remind everyone that a few years ago, the OECD published a very important report showing that in the health system, there's a huge waste. This waste, according to that data, showed that we could save about 30% of the existing costs of healthcare, not only in oncology, but in healthcare in general, by being more efficient. And this is really what we are striving here with All.Can, with the cancer patients organizations, to provide in the cancer area. We just heard about the importance of access to the patient data, to the fact that we should be able to share data. This is not easy. We have this law GDPR that is out there that complicates the life of everyone, that is interpreted in different ways in the different countries and within the regions of the different countries. And this leads to some examples. I'll just give you one of practical daily life in my practice in Switzerland. Okay, we are not part of Europe officially, but we do behave a little bit like many European countries that I know very well, like Italy, where I was working for quite a few years. If I want to have access to the patient's lab data, I don't have it. I need to be in the system as one of the providers. But if the patient comes to me on his or her own will, I will have to demonstrate that I have to have access. This makes no sense. We have found solutions, but this is still a problem in many countries when you want to transfer. We know that at the European level, one of the many wonderful initiatives of the European Beaten Cancer Plan is to develop an access to the patient data, to have the patient having a system whereby has a record of the data on what we could describe as a little card with everything electronically accessible. What do we know about the way that this is going to be read? How are these going to be read? We know that, unfortunately, the patient records, even when they are electronic, are not readable, simply because there are at least, and I'm speaking only of small Switzerland, 20 different systems with which they are encoded. So how are you going to transfer that in electronic format? This is a huge problem where we need to be much more efficient. And then let me speak about bureaucracy and the inefficiency. And this is when you are asking, for example, for a wig for your patient who has unfortunately hair loss because of chemotherapy. In the Swiss wonderful system, so efficient, I have to fill in 3 pages in order to request this wig. This makes no sense. Is this going to be solved? Maybe. I don't know about other countries. And the most important point, I believe, is to collaborate with the healthcare providers, all of them, starting by the general practitioner, who plays a very important role in many European countries, and unfortunately not in all of them. I'm a strong believer on the importance of the general practitioner who knows the patients, knows the patient's environment, knows what has happened to the patient, and who can help a lot, because the oncology centers are overwhelmed by the increasing number of patients, as so clearly stated by Tomislav Sokol in his very nice presentation just a few minutes ago. We know that we have more and more cancer patients because of a wonderfully aging population, which unfortunately has some health issues also. So we have to work all together. So these are just a few points I would like to raise here, and happy to participate later in the discussion.
Okay, thank you, Matti. And we'll have more than 4 minutes, so we're going to probe some of those points a bit later as well. And again, a reminder to the audience: please do post your questions as we go through. Amadou, so one of the things that we maybe had the pandemic has highlighted is that these common goals of improving resilience, improving equity, and improving efficiency which might have been seen as once as contradictory, actually are synergistic, and when improving one means improving them all. Maybe that's something you would like to elaborate on, but particularly from an industry perspective that you represent. What is the role of innovation in addressing those linked priorities of resilience, equity, and efficiency?
Thanks, Vivek. And I'd like to start by thanking the member of European Parliament, Tomislav Sokol, for his engagement in the coordination of the approach, the efficient approach to cancer care, and his talk today. I'm also delighted to be part of this panel with colleagues, experts from All.Can and the EU Commission and across the cancer community to discuss how we can together build efficiencies along the cancer care continuum, as it has been described earlier by previous speakers. I also want to congratulate all those who have contributed to the policy blueprint that is being launched today. So before I address your question, Vivek, I just wanted to acknowledge how disruptive COVID-19 has been as a pandemic, both if you look at the perspective of prevention, diagnosis, care, treatment, and monitoring. And I'm afraid to say that in addition to the statistics that are well known, which are that 1 out of 3 countries in the European region, according to WHO, has had disruption in cancer services. And this will be, the impact will be seen later, in time. It has already started, but definitely in the next 5 to 10 years, we will see more of that impact. So the question for us is how to build more resilient healthcare services. How can we address the inefficiencies that Matti was referring to earlier on? I think clearly the challenge for us is looking at the burden of cancer and the death toll that it has had. 10 million patients, around the world in 2020, which is projected to become 16 million patients by 2040, and unfortunately the largest proportion of these in the developing world. So I think we have a fantastic opportunity with All.Can to join hands, coming from multiple perspectives, whether we talk about patient representatives, academics, healthcare professionals, policymakers, and the industry, as you mentioned, to address those inefficiencies. And I think the best way to go about these inefficiencies is really to look at what are the outcomes that matter most for patients. And here I'm paraphrasing what Margareta said earlier on, which is that if we focus on this, if we keep, patient outcomes as a beacon, we probably will never get wrong, or quickly. Looking at All.Can, it is really one of the main achievements to look at where is the waste, what can be divested, and what can be reinvested in more efficient approaches. I think one statistic that many know is that using inefficient practices across hospitals in the UK has generated 5 billion waste per year. And this is just one example that can be addressed. Now, if we look at the new policy blueprint, I think, one aspect that Alex mentioned is that it involves driving evidence-based innovation across the care continuum. And the example of Matti earlier on, that he couldn't access some of the data, is also telling in that regard. I think whether we look at prevention, diagnostic tools, innovative treatments, I think employing, for instance, telemedicine or remote patient monitoring or using outpatient care services where possible have been ways to palliate the challenges. Importantly, the innovation must also be evaluated according to measures that matter to patient. And here again, Margaret's comment was very telling in that regard. So I think innovation is the driver. It should be influencing regulatory and policy frameworks that foster efficient technologies, but also the kind of measures that support the adoption of that innovation. And if we look at data, which has already been the object of a lot of focus of All.Can, it has a crucial role to play, helping identify high value, efficient practices, which should be supported and scaled up. And scaling up is really the purpose of the efficiency hub that All.Can has been able to build over time. There are already 40 best practices and more that are available for being scaled up. And I think that one of the examples I like to feature, because it is a very simple example, is the example of the PROCHE program that was implemented at the Georges Pompidou Hospital in Paris, where a simple intervention of assessing what was the status of patients before they come to the hospital and receive an infusion, that intervention has cut by 50% the waiting time for patients, but also the wasted time for healthcare professionals. And that has had also a positive byproduct in reducing the waste in terms of medications being used. There are other best practices that I will not mention here, just being mindful of time. But I think that the connection of what All.Can has to offer with major initiatives such as the European Beating Cancer Plan are really to be explored. And we should hold ourselves accountable for checking over time how much of the best practices identified are actually being rolled out and implemented. So back to you, Vivek.
Thank you, Amadou. Again, we will probe some more of that as time allows, and maybe look at some more of those examples with the panelists, all of the panelists assembled. Matthias, you're leading the Cancer Task Force of the European Commission DG for Health and Food Safety, and you're driving the European the Beating Cancer Plan. So I think it's fantastic to have you here, and really think I want to really understand how you perceive efficiency within the context of what's the role of efficiency in the Beating Cancer Plan, and how do you think that the implementation of the plan will yield efficiency improvements? So yeah, that's really the core. Then you can elaborate on that in any way you wish.
Yeah, thank you. I mean, I think the examples and the need for efficiency have already been given by some of the presenters before, so I will not go into that. Perhaps I will focus on the priority actions that Alex has identified in his presentation in terms of strengthening cancer prevention, ensuring early and accurate diagnosis, and also providing patients with access to prompt and well-coordinated specialist treatment. And link that perhaps to the implementation of the Europe's Beating Cancer Plan, to perhaps highlight a couple of actions that we are rolling out as we speak, actually. The cancer plan has been adopted in February last year, and we are now one way basically into the implementation of the plan. And if we look, for instance, at prevention, and one of the measures here is mentioned vaccination. We have a flagship to eliminate cervical cancer by HPV vaccination. And we have rolled out or started joint actions with member states, and also launched a call for the stakeholder community at large that will be complementary, supporting this action, with the goal of vaccinating at least 90% of the EU target population of girls, and increase substantially the vaccination of boys. Another example that's mentioned in the report that's released today is the issue of health literacy. And here again, we have already initiated work to update the existing European Code Against Cancer. In that, we will be working with the IARC, the International Agency for Research on Cancer. We also will soon release and publish a tender to develop a new mobile app for cancer prevention that will aim to better disseminate this knowledge about cancer and how to prevent your cancer risk individually. And we have already also launched a call for proposals again to civil society to support this dissemination action. If we then look, for instance, at health literacy, again, we have launched a call for proposals for a project to address both health professionals and patients to improve their health literacy. A huge, let's say, workload or a bulk of work on cancer screening is actually launched or will take place this year. We are proposing a new EU cancer screening scheme, which at its heart has the update of the 2003 Council recommendation on cancer screening. Both the Commission's group of chief scientific advisors will present at the beginning of March their opinion concerning the evidence that they see in terms of updating this opinion, this recommendation. And secondly, yesterday, we closed the call for evidence also on this matter, where we have invited stakeholders to provide their input. Linking to that is also the implementation of pilot schemes for implementing in the member states the breast cancer screening and treatment guidelines and quality assurance schemes that have been developed by the European Commission under the European Commission Initiative on Breast Cancer. And for colorectal cancer, we have launched a similar process last year to develop first guidelines and the quality assurance scheme, and then pilot that and roll that out in member states. Linking to that, there's also a number of other actions. For instance, we will look at innovative approaches to other types of cancers like prostate, lung, and gastric cancer, and calls will be launched this year. And also under the Horizon Europe program, there is quite a significant budget allocated, 60 million, to develop also new methods and technologies for cancer screening and early detection. Also this year, we will launch the European Cancer Imaging Initiative to build on or to develop actually a new EU Atlas of cancer-related images. A call for that was also actually launched last week to create a federated European infrastructure for cancer images and use that then to develop new methods for cancer diagnosis, screening, and also treatment. And perhaps, and not to take too much time, looking now at the last area of treatment, we have already launched actions to support member states to develop, implement, and develop further comprehensive cancer infrastructures and link them at the EU network at the EU level to provide holistic interspecialty care across the EU. We are also creating new networks of expertise for specific cancer conditions and specific cancer types. And we also have launched, or will be soon launching, the first interspecialty training cohort to treat, or not to treat, but to train cancer professionals in a holistic and interspecialty approach. So in a nutshell, some of the highlights of the work that we have launched already under the cancer plan.
Good. Thank you, Matthias. I think that there's a question that's popped up, which sounds like you've answered that really, that the question is, it's an ambitious project that requires change across the cancer care spectrum, and the questioner has asked what would be a good starting point, but it sounds like, Matthias, you're saying that actually you're the multiple entry points that you're working on in parallel, given that it's such a, that you want to affect it holistically, and also that the concept of efficiency is kind of baked in implicitly into the entire European Beating Cancer Plan. The whole thing has, in a sense, got the idea of optimal resource usage because of the sustainability issues and wanting to drive patient outcome, it's sort of built into the thinking of it. Is it fair to say that you're sort of attacking the problem from multiple perspectives simultaneously, and that its efficiency is sort of baked into the concept behind the cancer plan?
Yes, I think that's fair to say, yeah.
Okay, thank you. All right, we're going to, that's very much the European perspective. We're going to now broaden it out geographically. I will pick up some of the other questions as time allows that are coming in. Thank you for those questions. Let's turn to Sonali. Recently, we marked the World Cancer Day. There was a powerful campaign driven by UICC, your organization, that was really looking at these gross inequalities that exist within cancer care internationally. And we know they exist within Europe, but they're even larger if we look internationally, within and between countries. And many factors drive that. So what's the relationship between this concept of efficiency and inequality? In what ways can inefficiency drive and exacerbate inequalities, or conversely, and perhaps more positively, how can reducing inefficiency, improving efficiency, how can that reduce inequalities and reduce disparities in cancer, in the cancer control and cancer care environment?
Okay, well, thank you very much for inviting UICC and for me to be on this really great panel. I think my answer is yes, of course, building efficiency in cancer care helps to, eradicate disparities. But I think, from a global perspective, it's very important to understand that we need a contextual look at what's happening in countries. And at the very start of that, we've talked a bit about that in the intervention so far, is data. Really understanding where the information is. To give you an example, in many countries, cancer surveillance information, population-based cancer registries don't exist or are very limited. So there's really no data, or very limited data, to plan their cancer system response. So this then itself impacts upon resource allocation in the health system. So what the government funds are able to allocate, where does the private sector fit in? How does this benefit the system as a whole? And then it's very important in terms of efficiency of where do you prioritize your response across the cancer control continuum. You need to look at incidence and outcomes across populations. I'm just giving a brief answer, but this is a really important part, which often we do take for granted in countries that have strong information systems that don't exist in other countries. I will return to this, this later, but it is a very important part of the patient-centered response. And we've talked about that a lot so far. Clearly, that's important to equity, because a good cancer program would ideally include services that are relevant throughout the life course and take the social determinants of health into consideration. And that is a topic that we are hearing a lot more about, which is really great news. It's one that we've really showed a lot through our World Cancer Day campaign. And just to give you an example, so the social determinants of health, again, they are the conditions in which people are born, live, grow, work. And, they include things like ageism, sexism, racism, other issues, social issues that affect access to care. Let me just give you the example of older people. So, 50% of people who have cancer are 65 years or older. But yet, the needs of older people in cancer systems, in health systems across the world are not optimal. Many cancers in older people are diagnosed at a later stage. Early cancer symptoms can be mistaken for everyday pain or minor illnesses. And then when it's finally discovered, the cancer treatment starts late. And that can include, of course, increase the likelihood of side effects and can reduce the chances of a successful treatment outcome. But furthermore, older adults also have comorbidities. They are more likely to suffer from chronic conditions and other non-communicable diseases like high blood pressure or diabetes. But I think Matti can really speak to this a lot better than me. But what we know is that, these systems are really not well integrated. So you've got patients having to come for different services. It's a siloed approach on different days for different exams, different treatment. Now that's very, very challenging. So a patient response is one that engages with patients as people and not as a patient with a particular cancer disease. And it's important for equity so as not to disadvantage people who have less means to be able to follow through on their care. And of course, in situations where their care is not covered by a national health insurance or private insurance, so they have catastrophic health expenditure, and that's been documented for cancer and other NCDs. Just going back also to this information management system, and we've all talked about it in bits and pieces throughout this, I really want to highlight this, why this is the standard in high-income countries. It's far away from many LMICs that still have predominantly paper-based systems, and patients have to take their records with them from place to place and start all over again with some tests and investigations. But the good news is that there are several LMIC countries increasingly implementing information management systems by developing interoperable databases and creating a digital patient record. Now, there is a way to go. There will be issues around patient safety in terms of the security and privacy, but these can be effectively dealt with in favor of the key advantages that this would give patients in navigating the services required for cancer and reducing that psychological distress and the need for support, which other patients may not have readily around them to be able to drive them to take them to their different appointments, and making that process a lot more smooth. So, and then my final point that I would really like to make around efficiency, which is also important for equity, again, knowing where to prioritize. And that's the importance of having in place a national cancer control plan. And that's about setting the goals, strategies, and activities that a country can do, to reduce its cancer burden in line with its health infrastructure and epidemiological situation. But this is critical to designing an efficient cancer care system, because it is built on a foundation of cancer data, and it shows where investments in the system need to be made to have an impact on the cancer burden as a whole, but also as an impact, very importantly, on cancer patients and their families in terms of their health and well-being. So thank you.
Okay, thank you very much indeed. We're getting a lot of questions in, which is great. So thank you all for being so engaged in this. We probably won't have time to deal with all of them, so just a heads up. But if as panelists, one of the advantages of the Zoom platform, if as panelists you would like to type in an answer to this question while we proceed, please do. And then that way we can cover more ground in terms of what our audience and participants would like answered. But we'll carry on in the discussion in parallel. Could I turn to you then as our final panelist, Eugenia? Again, looking from an international perspective outside of Europe, one of the things that's behind this blueprint was to devise it in a way that it would have, and I know you were involved in this, is to make sure that it was a broadly applicable framework. Of course, the challenge, I think the challenges are international, they're global, but how they manifest may be different in different countries and in high and low and middle income settings. So I'd be interested to see, really ask you about that applicability. So looking in your country, Argentina, what is the applicability of this report to that situation, and what are some of what's the applicability, but also what are some of the specifics where you need to kind of draw on the report, but then make it very specific to your setting?
Oh, and thank you very much, and I'm really honored of being part of this wonderful panel. And it's very interesting hearing all of you, because this is a sort of recap of everything of what we need so as to be efficient. Definitely, this blueprint policy report is essential for us. As you know, middle and low-income settings in general have poor resources, so the cancer control outcomes are poor too, so our challenge is even great. But I'm proud to say that we have this framework of this blueprint that really guides the way we are working with All.Can from Argentina, and also how we will continue working. And I'm happy to say that many of the projects are absolutely aligned with this wonderful blueprint. As an example, you were mentioning the importance of, Margaret mentioned the importance of health literacy. We in Argentina carried out 2 special sessions from All.Can Argentina about patients' experience and health literacy that were really very, very well received by key oncologists, first as a pilot test, but with very much success. So we made 2 different editions. And data for us is one of the most important things. In general, in Latin American countries, there is a lack of data generation, even though in Argentina we're growing a lot in that sense. So All.Can is an excellent possibility of a platform to generate that data. In fact, our own patient survey identified different barriers and some concerns that maybe we already know, but now we have the registry and the real data to show it. For example, the great delay we have from the onset of the symptoms and the diagnosis, and also from the onset of the diagnosis and then the start of the treatment. Of course, this is even more serious in people that are assisted at the health public system. We noticed that we have an average time of 6 months since the onset of the symptoms and the diagnosis. So we are working very hard in something that Matti also insisted, that is preparing general practitioners to identify the first signs of alarms, to be trained in screening programs and on the different resources available, so as to shorten that time and so as to quickly start with the studies requested for that patient, so that to avoid a patient going from one place to another with different specialists. So we are proud to say that from All.Can, we have already launched our own training program for general practitioners with the addition of different videos, first focused on general signs of alarms, specific studies that you may require. We will continue with the specific videos on screening programs. And also, as it has been so important to have this data, we are currently carrying out a second survey. The field is already finished. That is based on the well-being of cancer patients. Very aligned also with this blueprint report. We inspired this survey in the Paris questionnaire of the OECD, and we already ended the field where we are asking about different aspects related to mental, physical health, personal issue, quality of healthcare they are receiving in the different institutions. We are interviewing both people from the public system and from the private system. And now we are complementing this with some quality interviews to professionals and patients. So we think that this will be very important so as to collect data to share with policy decisions, with healthcare providers. So definitely we are proud of being part of All.Can and the possibility of having this wonderful framework to continue with these important projects that at the end will improve efficiency, always based on the patient as a center and always in an equitable way. So thank you very much for the possibility of sharing with you all this, and to end also the collaboration between the different actors that is key. We work together in Argentina with patients' organizations, academic institutions, scientific institutions, industry, experts in health policies, but also we work together with all of you because we really sharing and exchanging best practices from other countries. As yours is a wonderful chance to improve cancer care in Argentina too.
Thank you very much. Right, we have a whole range of questions which we need to tackle. I'm trying to, in my mind, trying to tie these together so that we can try and address them all at once, as it were, or within the time available. One of the things that keeps cropping up is that all of you have mentioned is around actually getting the right data from the health systems to understand, from our cancer care systems, to understand where the things can be made more efficient, and where and actually knowing what to solve for, quality of life data, patient reported outcomes, and so on. And maybe that's something we can, and there are a number of questions related to that. So maybe something we can interrogate first is really, specifically within Europe, and maybe this is addressed to Matthias, there's a question here, is that digitalization of health data and making sure that that's being done in a way that's coordinated and we can learn from it to reduce disparities and improve efficiency across Europe, particularly as related to both the process data, but also the outcome data. How is that being coordinated? And I think there's a broad question there around what you drive from the EU central level, and while also ensuring that member states are allowed to do their own thing, and which they do. So how do you find the right balance for that? So maybe I'll address that one to Matthias, but broaden it out to other panelists if they want.
Yeah, well, a rather complex question. I mean, it has been mentioned already, the key initiative that will be launched soon by the Commission and will also link to the Europe's Beating Cancer Plan is the proposal for the European health data space. And here, the concept as it's being developed by the Commission has basically two key foci. One is basically on the sharing of patient data across borders, so for the benefit of the patient treatment, and secondly, also making available in an anonymized way patient data for research purposes and also for public health purposes. So these are the two main focal points of this European health data space proposal. Of course, playing into issues like the GDPR that has already been mentioned, perhaps making data sharing across borders more complex, trying to clarify some issues, because as far as we can see, the GDPR is implemented not consistently in all member states, so there are variations which cause some problems. But this proposal, which should be adopted before the summer, I think will then, in the consultation with stakeholders, etc., help us to tackle some of these issues.
Okay, thank you. And then I can extend that sort of more globally. So Sonali, you talked about the issue, the issues around actually gathering, especially in low and middle income countries, having the epidemiological data, the demographic data, understanding where the failures along the care pathway, all the way from prevention to therapy, where those failures are happening, so that we know where to target efforts. What's happening? I mean, how do we move forward on that? Those are the challenges, but what's happening, and what is, say, UICC advocating for in the way of improving how resources are allocated to solve those problems?
Well, so there was a question also on City Cancer Challenge. I'll also tie into my answer. But first of all, one of the ways that UICC works very closely with the IARC on data collection, particularly using our TNM cancer staging system. As you know, TNM is a staging classification to measure anatomical extent of disease. You may be wondering why that's important to cancer registries, but we have a very important part of the TNM classification, which is really on working with registrars to be able to record stage in cancer registries. And that is not routinely done in many low and middle income countries, and actually may not be properly recorded in the clinician's notes. So we have a system and a training system that with IARC, we have been training registrars in several regions to be able to do that. And that's very important, because at the stage of which you're diagnosed then helps us understand where some of the upstream issues are. There are issues, there are problems. So what do we need to do better on prevention? What do we need to do better on early detection, on health literacy, on health promotion? So that's one project that we're working on. There was another question on City Cancer Challenge. So yes, UICC initiated the City Cancer Challenge, and it has now become its own standalone foundation. Just to say quickly, they have a lot of information on what they do in terms of data recording, so I won't be able to cover it now, but I would suggest you go to their website. But to say that data is really at the key of what they do a very intense needs assessment before a country is even accepted into the program. And then when the country is there is a large amount of time spent on collecting data from various different stakeholders in the cancer system. And then they do a sort of matching exercise, which is described more in their methodology of where you fill those gaps. And then they have a very strong monitoring and evaluation framework, again, available with case studies on the City Cancer Challenge Foundation site. So that's just a quick overview looking at the time, but you can find those resources. Thanks.
Thank you. Thank you. We've got a few more minutes left, but I want to pick up a question from Matt Hickey, who's a member of All.Can. Thanks, Matt. There's a question here about what excellence looks like. He's talked about centers of excellence, which I know you referred to, Matthias, and Europe being geographically compact. This becomes an important issue about allocating centers of excellence and defining standards. But I think more broadly, let me extend that slightly, and any of you, please feel free to weigh in. We need to have a model of what excellence means in cancer control. And do we have that model, or how do we measure that against the kinds of things we're talking about here, the efficiency, what matters to patients, good use of resources? Surely that's a critical part. What does it look like so that we can all move towards it? And is that something that's being built, or either locally within any of the countries or at an EU level? And hands up, anyone who wants to sort of chip in with any thoughts on this one. Matti.
I'm muted. Yes, thank you. This is a very important comment from Matt, and thanks, Matt, for raising this. If we look at the countries, at least those that I know of, there are different ways of looking at quote unquote excellence in terms of end results in these countries. And it just comes to my mind right now a wonderful study done in the Netherlands where they compare the results in different centers in terms of conservative surgery in breast cancer, later outcomes, a number of radiation. And by putting this in the hands of the different centers that did not have the same excellent results and couldn't explain it by the fact that sometimes centers have a very different patient population, realized that there was something to be improved. And since then, indeed, in this particular example, there has been a wonderful improvement. And this has been done in many other countries. So there are efforts around there. But for me, one important point for excellence, I'd like to hear from the patient representative we have with us, is that we should not only look at that, we should only also look at the fact that, unfortunately, many cancer patients need palliative treatment that will delay the fact that the cancer will one day win. And when this is being done, patients need to have much more support than they have nowadays in the majority of the centers where they are treated. Let me be really harsh about this, like numbers.
Okay, let me get, so Margareta, Maria, Eugenia, any of you want to respond to that?
Margareta here. I think it's a very complex question and difficult to reply to, but I know that in some palliative centers in Sweden, the care at the end of life is fantastic, really good. And in the other centers, they don't exist. So it differs a lot. I don't know, Maria, Eugenia, you may add something.
Well, I want to share some, not that wise, but some of the first results we are having of this survey about the well-being of the patients, where they comment on the excellence they are receiving in terms of healthcare. It's a surprise to see that in general, people from the public health system, show to be the more happy with the way they are being attended. But maybe there is a distance of the expectations and the reality. Sometimes they feel, well, I'm having this for free. I don't have any coverage at all. So this is fantastic. And so it's difficult, but what we are seeing that in general from private sectors are really more critic. But the truth is that we have a very fragmented health system, So the differences are huge. It's difficult to say where is the excellence. We need to work in efficiency and in equitable efficiency. So I think that's a big challenge.
And that's the same with us. We have these 21 regions and they're all autonomous. It's like living in 21 different countries. So it's very, very difficult to really pinpoint where you have a good end of life treatment, and where you have no treatment or no care, I would say.
So, I mean, I think this extends the concept when we talk about centers of excellence. We're not just talking about therapeutic excellence or diagnostic excellence, palliation, but I think there's another question that's been raised about return to work, and I know this came up in the All.Can patient survey, was these sort of things that lie outside the traditional health system, but which are really important to patients who have cancer, these psychosocial support, financial support, returning to work, this kind of thing. Which we won't have time to cover now, but I think, yeah, we're probably going to have to sign off, and apologies to those who's raised questions which we haven't been able to answer yet. But this is the beginning of, this is an ongoing initiative by All.Can, so it's something that we will be pursuing. You have our guarantee of that. We're going to be pursuing as hard and as fast as possible. And what we want to do is make the best of the resources available, what matters to patients, those overarching values, critically important, the ones that Margareta addressed, and that whole system perspective, which we've addressed just now. So thank you very much, all of you, for joining us and for allowing us to interrogate the report and the blueprint. And I'm going to hand back to Eduardo Garcia, the CEO of All.Can International, to round up and close up the meeting. Thank you very much.
Thank you. Thank you very much indeed. As a starting point, I would also like to thank all those who have contributed to make this session possible today. Our host, Mr. Sokol, our moderator, Viv, and all the speakers. And of course, my gratitude goes to all those who have contributed to the publication of the blueprint, authors and peer reviewers. We are very grateful for the past and future work of the European Commission and the European Parliament in ensuring that Europe's Beating Cancer Plan be fully implemented across Europe and be seen as a reference also beyond Europe. And so we trust that our own contribution through the blueprint, which is published today, will support the cancer community in building efficiency throughout the care pathway, and thus contribute to achieving the ultimate goals of the Europe's Beating Cancer Plan towards improved health outcomes for cancer patients. And in highlighting what lies ahead for All.Can in its efforts to generate evidence and support exchange of knowledge and good practices, let me mention our forthcoming efficiency metrics policy research project, which is aimed to develop a core set of internationally applicable and real-world measures that can be used by key stakeholders to assess efficiency in cancer care. This could become a foundational initiative that would evolve over time. All.Can will have other opportunities to address these critical policy issues. For instance, at our global summit in June, to which we were all invited, of course, and then later in the year in a session at the upcoming UICC World Cancer Congress, thus maintaining always our engagement with the cancer community. And like I said, we hope to meet everyone again at these occasions, and I'd like to thank you all very much for taking the time to be with us today. Thank you.
Thank you.
Goodbye.